I've been saying for 2.5 decades, if you ask me today what would be the best way to fix healthcare, I'd say end all insurance. Because then what would happen is nobody would go for surgery unless they were dying.
Yeah.
Because it's too expensive. And they would say, well, what do I do to stay healthy?
Doctors want freedom, yet they've got these golden handcuffs on them. Is what they are, is because
they're not even golden anymore. They're rusty handcuffs.
They're rusty handcuffs. Exactly. They've got these rusty handcuffs on them, but the thing is, they say the words. I'm only allowed to have 12 visits. So,
says who? Not physiology and anatomy.
I know, exactly. Like, who says such a thing? And it blows my mind because
that's like saying you should go to the gym 3 times this year so you can get in shape.
Exactly.
It's like,
that's all they're going to pay for the gym membership. And the person, of course, I'd never ask the person to pay anything, right? Because they're insurance. I know. But that is probably the ultimate loss of freedom, is being dictated by somebody outside. I'm not paying you unless you do it my way.
And you know what's really strange is when we finally teach these guys how to collect cash by showing the value of what they do, and the patient realizes this is valuable and it's worth going on a payment plan or going through Care Credit or whoever it is.
Yep.
When they finally do that and the doctors say, I'm getting more referrals now than I got before.
Because they were afraid people were going
to get upset because they're charging them more. Yeah. No, the people are going, if I don't go to you, I'm going to surgery, and that's a hell of a lot more expensive.
Or they're getting better. Maybe they're not even going to surgery. They're better for the first time in 15 years.
Right, exactly.
And somebody says to them, how are you doing that? I didn't think you could do that
And they
anymore.
gain abilities back they haven't had for decades.
Exactly, yeah. So if you want to talk about real freedom, it's the freedom to have the doctor-patient relationship not interfered with.
That's right.
That's freedom.
That's why we have some of these practices, like the one in Florida where he's doing cash, and he's doing cash like hundreds of thousands of dollars a month.
Yeah, I think he's over $300,000 or $325,000 a month.
And it's not
$325,000 a month cash.
Well, he was telling me
in the state of Florida.
Last time I talked to him, he had 2 weeks in a row of $100,000 cash.
So that's $400,000 a month. Do that.
That's
like
$5 million
$5 million practice in Florida, full of Medicare patients who have 100% coverage on Medicare because they've got Medicare with the secondary, and he's doing cash. And that's because his thought process is doctor-patient relationship. I'll tell them what they need. If their insurance pays for part of it, great. I think that's wonderful. They pay for some of it. That helps, right? But he tells them what they need.
Yep.
And I will tell you, the AMI now here for AMI. AMI's process, which teaches how to process a patient through your office, that brings a patient to the point, which this doctor brings patients to the point of, I'm willing to pay for that because I realize you're the first doctor that has ever actually told me what I need. Because all the doctors do the same thing, as they all do the same thing. They're beholden to the insurance companies. So nobody is actually telling the patient what they need. So when you become the first doctor that they've met who actually tells them what they need, it is like a breath of fresh air. They'll pay for that.
Yeah, and you know, the amount we're asking, I mean, it's like half the price of their car. And you go, what's more important, your health or your car?
And they maintain their car.
They're going to get a new car every 3 years.
And think about it, they're changing the tires on the car, the amount of money they're doing to maintain the car. They don't even do that on their own.
So when you look at it that way, you get so much more freedom, because then when you deal with like, well, I'm recommending that these people get rehab. Well, how much rehab should they get? Well, I don't know, 3 months is usually a good rehab program. That's why boot camp is 3 months, police academy is 3 months. That's why a personal trainer would want to work with you for 3 months, because that's what it takes to repair the body. Well, when you're not dealing with insurance going, nope, we only want 12 visits. Then you go,
want 3 visits.
oh no, I'm just going to tell them what they need, actually. And it's so much more freedom for you, for the patient. You know, they got to put up money. And what's going to happen is that patient's going to go back and complain to their employer that our program doesn't cover what I actually need. And there's eventually going to be enough pressure put on these insurance companies that the insurance companies are going to have to bow to that pressure. I've been saying for 2.5 decades, if you ask me today what would be the best way to fix healthcare, I'd say end all insurance. Because then what would happen is nobody would go for surgery unless they were dying.
Yeah.
Because it's too expensive. And they would say, well, what do I do to stay healthy? And you go, well, that's bizarre. And I'll go, well, it was bizarre before insurance. That's the way it was.
Yeah. Well, think of it this way.
And insurance hasn't been around for not even 100 years.
Well, think of it this way. The countries that went to 100% insurance coverage, socialist countries, right? Yeah. What happens is people will wait a year to get a surgery. People don't even get health care. But they all sit around saying, but I have 100% coverage. That's not health care either.
Yeah, well, you look at the people that come across the border from Canada and the United States to pay for their health care.
Yeah.
Because they don't want to sit around and wait for the government to pay for health care.
Yeah, totally. 100%, yes.